Young people 19 years old died after a suspected medication mix-up. According to the information I have here, the doctor prescribed hydrocortisone, but succinylcholine was administered instead. This happened at the Unidade de Pronto Atendimento in Natal. According to the information, this happened between December 16th and 17th, but unfortunately, now at the beginning of January, the patient passed away. Guys, this is very serious, so pay attention. In the video, I'm going to show you several things. I even have the vials here to show you, so that this video can have a positive impact on the lives of people who work every day. So that unfortunately this doesn't happen to any of you in your daily work. We're not here to judge what's right or wrong. Anyway, this is a warning and let's try to understand a bit. In other words, may this tragedy unfortunately bring us some lessons here. Let's go. Imagine the outrage, the family, everyone is in tears. Anyway, so this is something that's happening at the Unidade de Pronto Atendimento in Natal. For those from Rio Grande do Norte, specifically from Natal, you might already be aware of this issue. The grandmother and her family are desperate. She was an indigenous woman from the Potiguara ethnic group. Authorities at Funai have been notified. Anyway, so there are several things in a family context and these issues here. But let's get to the case, because for us, unfortunately, all that's left now is to understand the case and make sure this doesn't happen to anyone else, okay? On December 16th, she experienced a cardiorespiratory arrest with flu-like symptoms at the Potengi Emergency Care Unit and sought medical attention. And then, from the moment all this happened, on December 17th, she was already transferred to the intensive care unit of a private hospital. According to the Corem, the suspicion is that the young woman received a medication different from what was prescribed by the attending physician. It was found that the switch was from a corticosteroid to a muscle relaxant used in intubation. In this case, it would be succinylcholine, okay? The Natal Health Department launched an investigation and removed the staff directly involved with the medications. The Municipal Health Department did not give a date for when the inquiry would end. Corem President Manuel Egidio stated outside the Unidade de Pronto Atendimento that the case was under investigation for a possible medication mix-up. Here's a quote. Initial information is that there was a medication mix-up and a different medication from the one prescribed was administered. Although the dosages were the same, the substances were different. Okay, let's pause the reading to get the medications here, alright? So hydrocortisone and succinylcholine. Let's go. Let's try to focus here. Look, pay attention. Well, both have 100 milligrams, see? Both have 100 milligrams and hydrocortisone. It has two presentations. It comes in 100 and 500. Given the patient's age and weight, the doctor likely prescribed 300 milligrams. Did the pharmacy deliver it or did the technician get it, right? Which suggests 3 vials of 100 milligrams. She thought it was hydrocortisone, but actually it was succinylcholine. I'll talk more about succinylcholine later. We're investigating all of this. We are already requesting the medical records, all the documentation, so we can clarify how the dispensing of these medications was handled, from the prescription to the administration of the medication, who confirmed the situation. According to the family, the doctors found that the young woman had a cardiorespiratory arrest. She was assisted, resuscitated, and intubated at the health unit. The family requested the medical records and presented them to the doctor at the private hospital where the young woman was transferred. The document lists the medications intravenous hydrocortisone and succinato sodico 100 milligrams. Well, I didn't understand this part of the writing here. At the end, not here. Well, guys, I'm not looking for someone to blame here, right? I can make a video later so we can understand a bit more. I'm here to explain the action of these medications. Okay, for God's sake, succinylcholine is not a medication that the pharmacy dispenses. Take note. For God's sake. Succinylcholine is a medication for the emergency cart. Take note. Succinylcholine is an emergency medication. This medication can't be in the pharmacy where the dispenser sends this medication. So, in other words, let's understand the flow chart of the Unidade de Pronto Atendimento. I don't know which one it was, but for God's sake, releasing succinylcholine. As with last month, they released adrenaline again, which shouldn't be dispensed freely. Succinylcholine. It's a neuromuscular blocker, and specifically this type, because there are 2 types, is used for rapid sequence intubation, because it's ultra short acting, it will block the entire expiratory part. When you receive this medication, in less than 10 seconds, fasciculation already begins because the release of acetylcholine in the receptors is immediate in the nicotinic receptors. So the muscles become completely flaccid, so there won't be any expandability. So here's the thing. He used three ampules. It's absurd for a patient, for an adult patient. Later I can do the math, but for an adult patient, 1 ampule is enough. And sometimes you don't even use all of it because it's calculated. Imagine 3, and I don't even know, I was young, 19 years old, I don't know my weight, I don't know my mass, but imagine 3, man. 3, anyway, let's understand. This type of medication, guys, is for emergencies, and I'm sure she went there with flu-like symptoms and it wasn't an emergency. We use hydrocortisone for emergencies, but not expectorant. If both were prescribed, it wasn't an emergency. The patient was bothered by a problem and went there to resolve it, then received succinylcholine. And as far as I know, I think the technician who got this medication didn't get it from the emergency card, so the pharmacy released it. So guys, once again, structural errors and institutions need to urgently improve the medication dispensing process. This type of medication is one of those that cannot be released under any circumstances, not even with a prescription. There is no prescription that you can get that will allow you to pick up this medication at the dispensary, at the pharmacy, at the hub, or at the arsenal. These emergency medications are exclusively for the emergency cart, It's meant only for emergency medications, not to be messy. The pharmacy is not for emergencies. The pharmacy is for urgent cases, for situations where the patient needs it, AIDA. But if the patient becomes an emergency, you pull the cart and take it to the bed. The red room cart doesn't leave from there, and you need to have a second cart to serve the rest. In an emergency care unit, in an urgent care center, you understand? So, first step. We realized that there really was a failure, but where exactly those failures happened, we can understand. Sadly, another patient died on an unscheduled day because of a medication error. Remember that in Benicio's case, I said that unfortunately people die every day, every hour, due to care errors, and not all cases are brought to the media. That one about Benicio got a lot of attention. Now look at this one getting attention too, and think about the ones that don't. So guys, let's study, let's understand. I know there's a whole structural problem that I'm not going to talk about, but we can make a video discussing what it's like. A flowchart for dispensing medication works better so you can work more safely in your daily routine.